we know that people with long-term physical health problems like diabetes, cardiovascular disease, chronic obstructive pulmonary disease, the cost of managing those physical health problems is about 50% higher if you have anxiety and depression. So in principle, if you effectively treat the anxiety and depression, you should be able to save money in the rest of your healthcare provision. But, is that principle true? And there's some very nice recent studies in England where we've used data linkage to link up the NHS talking therapies data set with other data sets that we have to test that out. And the evidence is pretty strong. So, for example, we have now two studies that have shown that people who've had treatment in NHS talking therapies services have a subsequent big reduction in their risk of having outpatient or inpatient hospital admissions for physical health problems. And that's saving about as much money as the mental health treatment costs. There's also a really fascinating study in the European Heart Journal recently, last month or two, which followed people up for 3 years after successful treatment of depression in the NHS talking therapy services, and found a significant reduction in future adverse cardiovascular events. And that includes a significant reduction in heart attacks and strokes. So really, the mind and body are closely related. Of course, these are savings in the healthcare bill. Often governments are very interested also in savings to do with welfare benefits and looking at the economy as a whole. And we know that people with anxiety and depression are more likely to be out of work. And when they are in work, they often struggle to stay in work. And there's some very nice data in talking therapy showing that successful treatment can help that. So in the right-hand side of this slide, we have a study where we were developing some new services for people with long-term physical health problems and anxiety and depression, putting the treatments together. And we implemented those services quicker in some areas than others, so we could use the late implementers as the control group. And on the slide, you see the employment rates, pre-treatment of the two groups are no different. If, however, you don't have the combined treatment that we're offering, then you're going to tend to drop out of the labor market. So the employment rate is lower 3 months later. Whereas those people who go into the combined treatment services, their employment rates improve. And these are very big effects.